Hello, my name is Andrew Granello, and I just want to make sure that I have consent to you to perform my thorax and chest and lung assessment exam on you today. Is that okay?
Yes.
Okay. So first thing we're gonna move on with inspection, and we're gonna inspect the AP diameter of the chest. Note that it's symmetric on both sides. In the front, you should have a 2-to-1 diameter, which we do here. There should be no barrel chesting. Okay, you're also going to inspect that there's no use of accessory muscles. You're going to note that her rate is relatively regular with the rise and fall of her chest. There's no evidence of any diaphragmatic breathing, and at the same time, she does not appear in distress. She's not breathing heavy, and her depths are normal. So you're going to look at that anteriorly, and then Jessica, if you could please stand up and turn around so I can look at your back to the camera. Perfect. And the same thing, she's breathing in and out. AP diameter is about 2-to-1. Okay, no accessory muscles, no distress, symmetric on both sides. Perfect. Okay, you can go ahead and sit down. All right, you're gonna go ahead and inspect the nails for any kind of cyanosis or clubbing, which she has none because she's a normal patient. No cyanosis or clubbing. Same thing, inspect the lips. They're nice and blue and pink. I know she's getting enough oxygen to her lips, not cyanotic. Perfect. The next thing we're going to do after that is move on to palpation. And you're going to palpate anteriorly just for tenderness and chest for costal chondritis. Any tenderness here as I palpate?
No.
Any tenderness here as I, can you do me a favor? Lift both, yep, perfect. Any tenderness here as I palpate?
No.
Any tenderness here as I palpate?
No.
Any tenderness as I palpate?
No.
Perfect. So you're going to palpate in a ladder motion across both sections here of the chest. And then if you're a woman, like Jessica does, she's very nice. She lifts the breasts up for me so I can palpate down the lung lobes, okay? So there's no costal chondritis, no tenderness. Also, no respiratory excursion was checked there and perfect. We're going to palpate the back now, the posterior side. So posterior for me is a lot easier. There's no breast in the back. So you're going to palpate any tenderness?
No.
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 And any tenderness there?
No.
Perfect. Okay, so we palpated. There's no tenderness. There's no evidence of any respiratory excursions. Good. No evidence of any costal inflammation or in the muscles there of the lung. Next thing we're going to do, we're going to go ahead and test for tactile fremitus. So what I want to do is when I palpate here, I want you to say 99.
99. 99. 99.
You're going to use your palm. Excuse me. You're going to use your palm for this part. Say it again.
99. 99. 99. 99. 99. 99. 99. 99.
Perfect. Go ahead and can you do me a favor and can you turn around the other way? We're going to do the same thing. We're going to check for tactile fremitus. So the vibrations were perfect. I could feel them all throughout my palms here. Do it again.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. So she has vibrations were felt all throughout, and you're going to use the palmar surface of your hand to feel for those. Okay, we're going to move on to percussion now. So you're going to percuss using your middle finger, and you're going to use your other middle of your non-dominant hand. So I'm left-handed, and you're going to hit the DIP joint here in this hand to percuss. And all those were pretty resonant sounds. So we're going to do the same thing on the right side. Perfect. All right, we're going to have you stand up. We're going to do the same thing posteriorly. Perfect. Perfect. Okay, so those are all resonant. We did them anteriorly and posteriorly. We did all the way up and down in a ladder formation. We can go side to side, would be better to see if there's any abnormalities. All right, perfect. We're going to turn around. We'll do the same thing, side to side, anteriorly. And hers are pretty resonant throughout, which is expected finding. The next thing we're going to do is I want you to turn around. Posteriorly, I want you to take a deep breath and hold it. And you're going to go from where it feels resonant to dull. All right, and then it feels dull right about here. So I'm going to mark that with this marker. Okay, perfect. And then we're going to do the same thing. All right, now exhale and hold it. Breathe in and then exhale and hold it. I just had you breathe in and hold it, right?
Mm-hmm.
And go to where it feels dull again, which is a little bit above here. And you're going to measure that area, which for Jessica, in centimeters, it's literally about 3 centimeters. So that's perfect. That's the respiratory excursion, is about 3 centimeters, okay? Perfect. All right, last thing you're going to do is you can go ahead and sit down and look towards me. You're going to listen to her lungs. Okay, so Jessica, when I tell you to, when my stethoscope hits your chest, I want you to take a deep breath in, okay? So you're going to start in a ladder motion at the top. Deep breath in. Perfect. Deep breath in. 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 All right, now I want you to try to hold that up. Yep. Deep breath in. Deep breath in. And then release all the way out to the side. Deep breath in. Deep breath in. Perfect. So on the bottom here and in the middle, you're going to hear vesicular sounds, and then up here you can hear tracheal sounds and bronchovesicular sounds as well. Okay, her lungs are clear. There's no adventitious breath sounds, no crackling, no rhonchi, no wheezing, anything like that. So that's going to be done with the anterior side. Now I want you to turn around. We're going to do the same thing posteriorly. When my stethoscope hits you, I want you to take a deep breath, please. Same thing, listen right underneath the shoulder blade. Go ahead, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. One more. Perfect. Okay, we're going to listen to the side one more time. Deep breath. And we're going to do the other side. Perfect. So again, her lung sounds are clear everywhere I listen to. The main thing that we're doing while we go in a ladder formation is we want to notice if there's any difference from side to side. It should be the same extension. Okay. The last thing that we can do for our test is we're going to listen for egophony. So you're going to listen with the stethoscope, and Jessica, when I tell you to, when my stethoscope hits you, I want you to say the words 99, okay?
99. 99. 99. 99. 99. 99. 99.
All right, perfect. So that's great. Egophony, if you, I heard muffled sounds, heard muffling saying 99. If you heard the 99 clear, that would be an indication that her lungs have some consolidation, whether that's pneumonia or some kind of fluid. There'd be some kind of junk in there that should not normally be in there. One thing I forgot to mention, that respiratory excursion test, which I measured 3 centimeters, you would do that posteriorly and anteriorly. I did it for posteriorly just for the sake of this video. And just to make sure, I didn't remember if I asked, do I have consent to do this for you?
Yes.
Okay, perfect. And that would be the end of my AP thorax and lung exam.